Tom Gannett feels like he's fortunate to be alive.
So positive, so blessed, so just being the 100th transplant here just blew my mind.
Since 1984, nearly 600 transplants have been done at the University of Chicago Medicine. Tom is the 100th person to receive a transplant since the program was rejuvenated just 3 years ago.
Since we revamped our program, changed the personnel, changed the protocol, we changed 100 patient life. Is a landmark. 100 is always a nice number, but for us it's not a number. It's another patient that have a beautiful life now to spend with his wife and kids, and each one of those patients is so special.
The success rate of the program has been very good.
It's a high-risk program, but when you have a high-risk program with great survival, that is exemplary.
These dedicated men and women work in one of the very rare elite medical facilities to transplant people who have tested positive for HIV, people with religious beliefs that preclude them from receiving blood products, and multiple organ transplant patients. They take on the most difficult cases and still get outstanding results.
You could get great results if you super select your patients. Don't give therapy to people who potentially could benefit from it to protect your statistics. But I can tell you that we don't do that, right? I mean, we take on very difficult patients.
Transplant work takes a big team, from social workers who provide support and evaluation to nurses, cardiologists, physical therapists, and surgeons. The University of Chicago team uses the newest technology to help get these positive results. Tom is a beneficiary of all this technology combined with teamwork.
His operation's gone well and he's done fantastic. So he's kind of the epitome of the high-risk patients we do, because he was multiple organ. The new technology that we've used, which is the IVAS, which is a technology that we're the only ones in the world who have. And using all that combination, he ended up getting his heart-kidney transplant in a very short period of time.
Tom used the new Pulse IVAS device. It is minimally invasive and helps with circulation. It allowed Tom to actually go home for a time and build his strength as he waited for a donor heart.
So when I was lucky enough to get onto this new Pulse, this beautiful thing that made me be able to walk again a little bit and breathe a little bit better and get ready for this.
Tom says his caregivers have been fantastic at the University of Chicago Medicine.
So attentive. They listen to me. If I tell them something's hurting, they listen to me.
They have helped him on his journey to a new life, and he doesn't take this second chance for granted.
It's all ahead of me. Sum it up in a few words. I mean, like I said, I want to change the world. I want to make it a better place.
Tom is an example of teamwork, research, and technology coming together to change and save a life. It's a special blend of work that's not lost on those involved with the transplant program.
72 hours after the surgery, he's already on the floor, walking around, and have a new heart, and a new kidney, and a new life.